My name is Mike Riley. I'm the Director of Healthcare at IPORT. And at IPORT, we're passionate about helping providers transform with iOS. We believe iOS is the best platform when coupled with IPORT's world-class wireless cases and chargers and best-in-class iOS applications to truly enable caregivers to transform with iOS. Now, one of the challenges that we hear is really around connected care between patients and caregivers. Oftentimes, patients can feel very isolated. They can feel anxious, obviously, about coming in for treatment or having a family or loved one coming in for treatment. And technology, and particularly Apple with iPort and various best-in-class iOS applications, can really drive that connection between patient and caregiver, truly helping patients feel heard, feel valued, having their questions answered, feel connected and more relaxed when they're in a care environment. So one of the primary places where Apple technology and iPort are deployed is in inpatient settings. I want to share a very personal example with you. I had a very close family member who was over the age of 65 that was admitted into the hospital for a double case of pneumonia. She came in through the ED. She had a very diligent care team. When she was brought up to her room, the nurse took her vitals, made sure her pain tolerance was okay, or her pain level was okay, also gave her the appropriate medication that she needed. At the time, this family member had difficulty hearing due to also an ear infection, in addition to the double case of pneumonia. So it was hard for her to really understand her care team. The nurse informed her that her pulmonologist would be there sometime tomorrow, say between 12 and 8, and to call if there was any needs. Now, that's a very unfortunate, isolating experience for this family member. Because again, it was hard for them to understand. They had anxiety. They weren't quite sure what the treatment was going to be. They didn't know who their care team was and what to expect. And unfortunately, that family member was there by herself. This is where it's really exciting what leading providers are doing with iPort, Apple, and various best-in-class iOS applications. So our wireless cases, you'll notice, just sit on a base station right by the patient's bed. We've got this deployed at a number of large health systems around the country. There's no cables to plug and unplug for the patient. Care team members who have to come into the room don't have to worry about tripping over cables, but it's a super seamless process for the patient to now engage with the iPad. We also have other healthcare customers that prefer that these be mounted on the wall in one of our flush wall stations where they can get both power and data over Ethernet, or mounted on carts. The point is, it should be a simple and seamless experience in how that patient engages with the iPad. On this device are really critical applications. Now, certainly MyChart Bedside in the Epic space is a great way for patients to interact with their care team. It's also a great way for them to understand about their treatment, their diagnosis, ask questions to their care team securely, learn about their test results. But what we've found is the iPad is also a cost-effective way to better relax the patient, inform the patient, and some of the best engagement happens when this iPad becomes a critical part of the patient's stay. So we have a very great partner called DigiValet that actually is really big in the hospitality space, also really big worldwide in healthcare. And on their app that would run side by side, say with MyChart Bedside, you have the ability to do in-room controls. So I can control the lighting, the temperature, the shades of the room. These are typically things that I would have to call a member of the care team to come in. They would have to stop what they're doing, come in, make it warmer, hotter, etc. But I can do this direct from the iPad. I can even order in-room meals. Keeping in mind any dietary restrictions I have, I can order meals from the cafeteria. I can even order meals from family members. I can have multimedia. So using that iPad that's paired with a TV in room, I can watch movies. I even get regular surveys throughout my stay. So I'm giving the care team real-time feedback. So you're getting a better experience for that caregiver. And then when you surround the device with an app like DigiValet that requires the patient to use it and they're using it throughout their stay, it's going to get them more likely to go into MyChart Bedside and start learning about their treatment, learning about their care team. This is a super simple, cost-effective way to relax, to engage your patients, to hopefully drive better care outcomes, better patient satisfaction scores, and hope to ultimately drive better care outcomes. This is one way that healthcare is running on iOS and how iPort is doing it.